So I'm not saying that they might not be necessary, because I don't want any human being to suffer, right? And sometimes you have to take medication. For me, I had my thyroid gland removed 18 years ago because I had cancer. So they took that out. And interestingly enough, which I didn't know at the time, that might affect me later, they took out a majority of lymph nodes in my neck, which just might interfere with my ability to drain toxins from my brain or my whole body, because out of the 700, 800 lymph nodes in your body, 1/3 of that number is from the neck up. So they're sort of important. They're there for a reason. So I have to take what's called levothyroxine, which is a type of synthroid, because if I don't, I'm going to be dead within 4 days. So I got to take it, right? But then I know on the back end, I'm going to have to do a lot of other extra work because of that. But now in hindsight, now that I've learned more, I started asking myself, why in the hell did you get thyroid cancer, Perry? What's up with that? And now what I'm contending is that it probably was able to manifest itself because I was so toxic for so many years and didn't realize it. And, you know, they can take out the tumor, which they should, right? But if you don't take care of the environment that the tumor grew in, it can manifest later as another tumor, or it can manifest itself as something else later. And I firmly believe, for me, 15 years later, it just decided to manifest itself as my autoimmune disease. It came out later because they took it out, but I didn't change anything of my habit. That's what frustrates me about medicine. I'm not bashing them, but just a paradigm I hate. If they find something on a scan, or they find something here, they say, oh, well, we'll monitor it for 6 months. And I'm like, okay, but what am I going to do differently in these 6 months? And we'll see what happens. Well, probably it's going to get worse because you're not changing anything that you're doing. And then all of a sudden, when it gets bad enough, or the pain gets bad enough, then that's when we're going to try to do something to help you at that standpoint. I would like to get it before you get to that standpoint, which is why we're struggling so much with chronic disease and autoimmune today more than ever before. We are really good at saving your life and putting damaged parts back together.
Yeah.
But I'm going to tell you, in my personal opinion, we are absolutely horrifically awful at putting the chronic pain and autoimmune puzzle together. We're going the complete opposite direction. So we have to change our lens. We have to change our thought process. But unfortunately, with what I see, we're going in the other direction.